Dr. Rhee, welcome to Endurance Minded. How are you?
Hey, I'm doing awesome, man. I'm excited about this conversation.
I am as well. Yeah. You are the perfect candidate for this show, given your experience and all the things that we like to talk about. You got the medical background, you got sports, and all kinds of history that we'll unpack in sports and performance and chiropractic and body work. And so there's a lot of angles we can get into here, and every one of them is gonna resonate. So we'll start where I like to start with most folks, which is at the beginning per se. So I'd love for you to just tell us where you started. What brought you into chiropractic care and performance medicine, and kind of set you on the course and track for where you find yourself today.
And it starts when I'm young. I'm a very active kid. Just like anybody's active, they always think about going into the next level, which is like back then it was like elementary school to high school to college of pros, and you always end up in that mindset like I'm gonna be a professional athlete. But as your body grows, it stops at a certain point. Because I don't know about that little adventure for the professional world and football, especially. So I knew that I always loved sports. My dad was a physician; he was a surgeon, so I knew that it was like mostly like meant for me to go in that pathway. And also, I'm trying to blend sports in there. So then you discover about sports med and understanding about it takes a team, and part of that team player attitude is the medical side of it. So that's where I started thinking about going in that realm of team and the medical side of it. So from there, went through the old world of growing up and going through little challenges in life. And then, because of my personality, I ended up in the military, in the Navy. Best thing in my life, straightened me out. I flew in the Navy, a thing called an S-3 Viking jet. We hunt submarines with a backseater, did some fun stuff with that. But it taught me a lot of lessons about how to pursue and persist, keep going on and never quitting. And taking that good template, I applied that when I got out of the military, went to college, and I did well like any other student would do if you just put your mind to it and you have the good kind of tools. So then went to college and went to chiropractic school, and with that mindset of always being in the sports world, always being a professional, kind of like that sports mentality in that sports medicine world. So after school, ended up at UCLA as the medical chiropractor for their athletic department. Worked with like track and field, football, basketball, soccer, and all the sports that they have at UCLA. And the fun thing about UCLA is that I get to see that caliber of athlete from the elite high school into the collegiate world. And then you see those that actually go into the professional world. So you see the transition and you see what they do to work out, how they recover, how they get from an injury world. And then you're part of that whole little system. So as these guys graduate from college, they go into the pro world. And here I am in the pro world, just following along, just traveling. They say, hey, I got this, I got that. So I'm just going everywhere. So then I ended up in Tampa, Florida. In Tampa, I'm attached to some professional athletes, some Olympians, and then WWE. WWE was a fun little run. You get to see that kind of violence they go through. I mean, it's not just like one of those seasonal things. It's a year-round, twice a week getting beat up. So it's a very violent and non-recovery type of sport event per se. So then the Tampa Bay Buccaneers called me, and I worked with them between 2015 2018 as their team doctor. And I really specialized in the chiropractic side of it, the soft tissue, and utilizing this technique called ART, active release technique. And then from there, decided to go into the world of regenerative medicine, understanding that these athletes, what they do off season and what they do on season are two different things. So regenerative medicine had a little void in the on-season protocol. So that's why I started looking into doing a topical, and that's how I developed RheeGen, the topical. So that's the evolution of here I am now.
I love it. That's great. You can see how those pieces kind of stack from one to the next. I'm curious. You mentioned the how the military and the Navy specifically was so influential, and you said kind of straightened you out. I'm serious. I'm curious if there's anything from those military days that still maybe inform how you deal with things today, whether it's pressure, uncertainty, you're, building, another business, and, are still, sounds like very busy in lots of different spaces. And I'm sure with that pressure mounts, and, you're not quite sure if, how things are going to work out. And yeah, curious if any of that still sticks with you. And if so, what specific, tools is that?
Let me tell you, before I went in the military, I was a kid that thought I knew everything. I thought I was, hey, I'm too smart for the world. I know everything. I have the answers. Well, the military snatches you up real fast and straightens you out. So with that, you learn these little, you look at the whole grand scheme of things. It's like, I don't think I had that much of a process of like starting from one and ending up at 100. You think that I just took that big step and became this person. But when you look really hard back at those times, it's about micro victories, these little wins, and how your mindset is. So I remember like boot camp was, it wasn't physically challenging. It was a little mental, but not too bad. But there's some great stories in there. But as you go through this process of the military, it doesn't give you a big thing of saying, hey, we have to accomplish this big goal. It's like small little victories of like simple things like how to fold your shirts, how to fold your socks, how to like make everything neat and organized, how to memorize some words. And it starts off with that in boot camp. And then you start elevating more complex things. So I remember with my attitude and my kind of like arrogance, how would you say, or I don't know, maybe ego, I would think that I knew everything. Nobody can teach me anything. I know I before you teach me, hey, professor, teacher, I know it all. Don't worry about it. I know it. When you go through school, I remember a guy named Montgomery. He looked at me because I had that real snappy mouth that thought I knew everything, just being a silly guy. And he looked right at me and he goes, Rhee, that mouth is going to make you or break you. You better pick right now. And from that point on, it's like I knew that I better just shut my mouth and become a sponge and just absorb. From that point, it was about just listening and really tuning into what they're teaching you, and then learn through that process of just going into like small little victories and just continually going on into that process to where it becomes one big step. Instead of like, looking at, like we all think like, hey, I want to lose like 50 pounds, or I want to create this revenue of this kind of number. Well, you want to look at that for a grand scheme of things, but you have to look at the steps to achieve those things. So the military put those standards in there. So once you get that template, when the military really shows you about these little victories, little stepping stones, and then once you start having that like over and over repetitive, because you go through so much school when you go through flight, you go through like, you got just the ground phase of it, and then you go and you get in the air, and then you have the operational component of it. There's so many phases, but there's little testing points. There's always these milestones. So, and when it's repetitive over and over again, over an 18-month period of this training, it becomes almost like innate. It becomes part of your whole system. Everything you're doing now is like that process. Start with that small, idea that you're thinking about, go backwards and get those little steps, and then start taking those steps. So once you get the formula down, you can put anything in there, not take out the aviation, not talk about like just going to chiropractic school, talk about like injury, talk about anything. Cause then now you just put things in there. For instance, like let's say an athlete comes, sees you, and they say, I have this knee pain that I've seen from, like, I've been seen over there by the physical therapist, chiropractor, ortho, and they don't know what it is. I've been scoped, I've been MRI'd, all that stuff. Then you just take that little idea of what's your goal? I want to go back and go do an ultra run. I have pain at mile 20 or something like that. Then you find out, no pain that occurs before that. So you start understanding what he wants, and you work backwards and look at the anatomy. Then you look at all the anatomy and take the pieces. And then from that process, you understand the actual diagnosis and the cause. And then you work for the therapy component, and then you go into that therapy until you figure out that he can correctly do things the right way to take the pressure off that knee. And there you go. So my biofeedback is him doing an event with no pain, and it results as fine. So yeah, that's the military moving into the present time of what I do.
I love that you can, like you said, you can kind of use that equation and plug in whatever inputs you want, and just focus on. It's so easy, I think, for all of us, or maybe the natural kind of inclination is to forecast ahead and think about the big outcome based goal at the end, right? I need to make this much money. I want to do this thing. I want to accomplish this thing. I want to, and I think that also is what tends to stop so many people, is because that thing is so big that, you don't have the tools and resources and know-how to move on that right now, but you can move in one small step, right? You can accomplish one victory today, and then just stack that again tomorrow. And I love that equation, like you said, whether it's folding your shirts and your socks, or going through medical school. The equation is the same. You just have to rinse and repeat, small wins, step by step every day, and focus on that. I think that's a great kind of mantra to keep in mind, as so many of everybody listening to Endurance Minded are high performers, whether they're athletes, entrepreneurs, in business and career and life. Everybody's driving. And so I think that's a great reminder to just focus on that small victory, and the same equation applies no matter where we're at.
Yeah, it makes, like, for instance, like when I have a little bit, I don't know if it's called disability or whatever it is. I've got I've got dyslexia. Now, here's a funny thing about that. People look at that as a hindrance to where, I'm trying to do things as far as like a simple, like a email or letter, or, just reading and stuff like that. But then you look at the other side of it, which is basically it just teaches you how to go through challenges, how to look at it a different way to accomplish that goal. And it makes you kind of figure things out. But with that, you have to take the small steps, So my small steps, believe it or not, were just like, when I went through school, it wasn't a Scantron when it's like A, B, C, the answers. You had to write out the actual, the name of that anatomy or whatever it was, and then spelling counts. So then I would sit up all night long and doing these, like, how you study for a spelling bee, right? You write the word 10 times over and over again, just write it. Mm-hmm. So it was interesting, because I'm thinking about, like, I'm just trying to do the actual spelling component. But the other side is that I get to really look at this word in a different side, in the sense of I'm not just using my eye or the other senses, right? Now I'm using tactile, I'm using other senses that really gets me in that word. So it teaches you more so of, like, getting these micro victories, but using other senses to it too. So it was interesting to have this kind of, like, I don't know if it's a gift or a disability, but I enjoy what I have.
Yeah. Yeah, I've heard, just not specific to dyslexia, although I know several people that are dyslexic and have described it in this way. But in general, that, your kind of greatest frustration and greatest obstacle is also your greatest superpower. And because it does, you have to adapt. You have no choice, right? You can either let it crush you, or you can move on. And so I think, again, that's just a great perspective. And people specifically that I know with dyslexia have said that. They're like, well, I wasn't just going to sit by and watch the world and my goals pass me by. So I just came up with tools to adapt, and they're, have gone on to do great things. Everyone that I know that struggles with that is wildly successful. So I think ultimately it seems to be a superpower more than a hindrance, for sure.
Yeah, man.
Well, let's. I want to move on. I'm eager to talk about just some of the nuts and bolts and specifics of the work that you're doing, and how you see the human body, and what's informed your experience with working with individuals in that space. But I know you've worked, like you said, with very high caliber individuals in the athletic space, from NFL to Olympians to Ironman athletes and so on. Let's just set kind of a baseline in terms of what you see in terms of the patterns that how these individuals were approaching healing and performance and longevity. So what was that baseline? What were those common patterns that you saw when it came to these individuals that you're working with kind of early on? And then what prompted the opportunity from your perspective for a shift? So set that stage for us.
All right. So I was lucky enough to have that level of athletes, from high school to collegiate to the professional to Olympians and all that, right? So there's that kind of like that eliteness that goes in there. So when you look at the younger athletes, it's all about education, right? When you go through a process of working out and you're achieving, you're doing great things, some athletes don't go through an experience like an injury or a setback. And then so when they start going into like the upper level and they do get injured, it's a huge mindset. It's a setback that they have never been, how would you say, experienced. So now, because of that, the mental side plays as much as the physical side. So just like anything else, if your mind is not right, your body's not going to follow along. So when I see these athletes and they've been through the process of being injured in the past, they know the protocols and they know it's temporary and they can get their mind in a positive sense and know go through recovery, go through rehab, go through surgery component of it, and then get themselves back. So it's really about the athlete's mind frame of setting it in a either they listen well because they've never been injured before and they just know how to follow directions, or they've been through the problem before, so they know the second or third time they go through this, I know the protocol, I know I can get myself back. I just have to go through this process. So when you see these athletes work out, especially when you look at the later stage, right, the professional, the elite, the Olympians, they know what it takes. They know about the compression and the workout and the push. They know that it's very important for that component to be there as far as a workout. It's instilled as a little child, and you'll go into your workouts and everything to high school, to college, right? But what they also do learn is about the recovery. That's the most important thing. They understand about breaking down muscle tissue, and then nobody really talks about the recovery, how to build it back up in that time frame. When you're young at 14, 15, it's a shorter period of time. But once you hit the 30s, maybe plus the 40s, the recovery is longer. The information or the signal is not there to tell the cells to do its job to recover. So they understand that. Then you have to think like, oh, how can I bring that time frame from long to short to get myself back on the field or get myself back to 100%? Then you go into the education component of it. You find someone like me, that understands about this process, and look at the special equipment out there, the special modalities, the special therapies out there that helps you get to that healing process faster. So these athletes, they are educated, and don't these guys are very intelligent. They may act like they don't know nothing, but they've been through every doctor and every anatomy. They do their own homework, so they understand what's going on. They just need to find the right type of person to connect these dots to say, all right, this is the path you need to go on. So athletes in general, they're very knowledgeable if they want to take that next step. So when I see an athlete, I always say, what is your goal? That's the goal, right? I want to get back on the field. Or is it, do I want to correct what I have a repetitive injury, right? So once you get that understanding and you're on the same team and the same mindset, it's easy to progress from that point on.
How do you balance an athlete's desire to get back to play, we'll say, whether, again, like you said, it's field, it's whatever the medium is, the discipline. How do you balance an athlete's desire to get back into competition over their long-term health? What's your perspective? I know for myself, being injured over the years, doing all kinds of different, activities, endurance sports and things, that was my primary focus. I was just like, how quickly can we solve this so that I can get back to training and then go do this thing? And I imagine from your perspective that that's, something that you have to kind of wrestle with. So what's that been from your experience and approach? How do you balance those two things?
Communication. You've got to get the communication on. It's a team, right? It's a team of the athlete, provider, doctor, maybe the coach, maybe the fitness person, but it all has to be one cohesive kind of like goal set. So you have to ask the athlete, what do you want? I want to get back on the field in 1 week. Now, you've got to really be truthful. It's all about, having the actual factual objective findings and say, this is where you're at. You have maybe a bursitis. Easy to work with. We can get you there. Now, when you have a tear, now you're asking, how severe is a tear? Is it a grade 2, grade 3? Is it a rupture? You have to be honest with them. And then you say, what is your ultimate goal? You want to play this one game, your last game of the season, like a Super Bowl, the World Series? Then we can work around, because, we know the outcome is if it's a rupture, you're going to have surgery. You're going to have to, but you're able to do things if you really want to do that. But then you take that next step because, well, we got that point, short-term goals and everything. But now long-term, what do you understand what's going to happen if we continue on with, let's say, you have a meniscus tear that's been surgically repaired twice. Think about the long-term osteoarthritis. You're going to be in that world of possibly, you're losing that joint space. You're going to be bone on bone. Now you're looking at an artificial knee or something like that. So those are the truths that you have to, everybody lives in the moment. Everybody lives in the present. But to go to an athlete's mindset and say, all right, think about 20 years from now, it's tough. It's very tough. So we have honest conversations, and then we talk about what is your outcome? What is the idea? And then, that's what determines how to really set that conversation forward. So It's not an athlete, especially when you start off as a rookie or your first year contract. There's not that long term conversation. It's tougher to have that conversation. These kids think they're invincible. They're like, I'm not worried about that. When you look at that later stage athlete that's in their maybe third year contract, they're thinking about, okay, this is my last year, but I still want to be able to hold my kids, walk with my grandkids. They're thinking about the long term, and then we have that discussion at that point. So it all depends on the phase of their life and their career.
Mm. Yet another case for communication. I've long said that I think our ultimately boiled down, our only job is to be a great communicator. And that good communication solves most things. We think that it's more complex or convoluted, but yeah, I mean, just good old fashioned. Let's talk it through, right? Let's weigh those balances, and I think that applies to to whether it's an age group athlete or an elite athlete. You have to balance. You have to say we have these near term goals, or maybe they're even long term goals, but what's the what are the what's the real impact here, and is it diminishing returns? I think we have a tendency to err on the side of short-term gains for potential long-term impacts that aren't necessarily in alignment with our goals if we're honest. But athletes are in that mindset to push, and we're used to pain and used to and so having someone like yourself to help kind of level set and take a step back and say, hey, okay, I hear you, but like, let's also zoom out 20 years.
I think the big thing is that the conversation, but I always start the conversation with, all right, you've got this, but what are our goals? What do you want to do? I know you want to get on the field that week, that month, whatever, you want to recover, but what is the other goals? You want to have, your first year contract? Are you looking for a career in this business? This is sport. Are you looking to do something else? Once he sets that standard of what the achievement is supposed to be going towards, then the conversation can lead toward that way. So, all right, we can do this, but just be aware that this could happen. Or if you don't want that in the long term, then this is a process. So you give them an option. I think athletes want options. They want the ability to say, I can pick my destiny. Let me pick don't tell me something that I can't or cannot do based on one type of option. Give me multiple options, and they'll pick their own option, and they set the course. And then we just work with our course.
Mm-hmm. Love that. All right, I'm eager to get into some of the, or maybe all of the science and technology that you're working on with RheeGen, and where you're at now in your practice, and how you're supporting individuals with recovery, and how they think about their care. So let's do a little bit of let's set the stage here. I'm curious, what was the moment, or even kind of the impetus, where you said, okay, I've got this career and this history with all these elite athletes. I've had all this data. I understand the body. I know how to communicate with these individuals, but I imagine that there was some moment or a series of moments where you said there has to be a better way than injections and invasive treatments, right? We've done that. We've got into that. So walk me through that. What led up to that thinking? And again, was it a specific moment? Was it moments stacked on themselves? Walk me to what led up to that narrative that started to build, that set you on the pace to, or the track to where you're at now.
So I've been in this space as far as regenerative medicine, stem cell therapy, for a long period of time. We did it in our office, and athletes, even weekend warriors, everyday person would do this type of regenerative medicine with this osteoarthritis, or maybe a strain or muscle pull. They want this therapy to help heal faster. So during this process, there's a protocol that there's a pre type of injectable injections, and there's a post, right? So the pre is basically you warm the tissue up. You do a lot of this other type of devices, and you get the tissue ready to receive this type of stem cell and information. But the post is about downtime. You have to let the tissue recover. You have to let the actual the incision point where you took the second needle, the second injury site, the needle, and you have to recover from that, that injury site. So you have a primary injury site, and then you have the secondary, which is caused by the needle. So then you start looking at this and this whole type of system, and this system of going through this procedure can take about 2-3 weeks. And during that period, you're not able to do anything. You're kind of like downtime, basically just slowing the tissue down for doing any kind of explosive or any type of stress to that joint. So when you look at these athletes, off-season stem cell therapy, regenerative medicine, they do that all day long. It's no big deal to them. But in the season, that's where it starts affecting their play, because about contracts, and contracts has its negotiation components of it. One of the components are injury, prone to injury, past injury. They don't like reporting that stuff. They think that if I have a knee pain, I can fix that on my own if I had this, if I had that, or if I had more rest. Well, I can't have rest on that. I need these other things. Well, I can't have stem cell therapy or an injection. So I need to keep myself alive. I just got to take the pain down. Here comes pain meds, something that masks the pain. So I hear that over and over with these athletes. I'm like, okay, there's got to be a different delivery system. The delivery system right now with the needles is too invasive. There's too much downtime, and there's risk factors. You think about like infections or something, may nick a nerve or some other artery, make it get like a hematoma. There's other factors involved with it, going into the skin, right? So then you start doing a little research, and then you start understanding about, okay, so what is stem cell? Is stem cells what these live cells we're trying to get into our body, and it's supposed to mutate into our existing tissue? Then you start thinking about that mechanism, and you see that, no, that's not what it's doing. It's not about these live cells turning into our existing tissue, because if you know simple biology, there's a chromosome from the other site and there's chromosome in our site. Those two can't match up. Those DNA sequences are not going to match up. So it can't do that. So the next thing you have to think about is a signal. It's all about the signal, information that these cells are secreting to do its job. So then once you understand about the signals in the form of like cytokine, proteins, mRNAs, just information that tells like our existing tissue to do its job, then you understand, okay, I just need to get that. It's a smaller molecule. It's cell-free, meaning there's no nucleus. Now I just need a topical type of application. Now I can put on the cream, but it won't penetrate through the skin. So I need a transdermal agent. Transdermal agent will allow those little molecules to go through the skin and actually get to the deep tissue. And that agent is called DMSO. DMSO is utilized right now by the FDA for that transdermal component. So now I have something that's small. Now I have something that goes to the skin. Now it's about putting it together and then now delivering it to that target tissue without that invasive needle. And that's how this all came about. So then I started putting it together. Then the big discovery that I knew that it worked is when I had an NFL quarterback. This NFL quarterback was in the worst scenario. He's end of summer. Now he's going to the camp. Now he's got these Achilles tendonitis, bilateral, left and right. And it's pretty bulbous. So it's like almost like a grade 2-3. It's about the rupture. Just like how you hear about these NFL players, tearing their Achilles tendon just by walking on the field. So then he's worried about that. So now, last year contract, he's worried about reporting this. So then, when you go into negotiation, they're going to say, hey, you got this injury. I'm not going to give you this kind of money or renew your contract or whatever. So that's what his concerns were. So I said, okay, I've got something for you. This is what I developed. And he goes, let's go for it. So then he took off with it. What he helped me out with is the fine tuning of it, just to kind of help me, like, it feels too hot, feels too cold. Let's do this, let's do that. So we kind of tweaked it around together. The great thing about him is that with that RheeGen product, he was able to play his season injury-free. In fact, didn't report it. And more importantly, he was able to continue on with his career by renegotiating his contract. So that was a great success story. So from that point, I said, let me back it down from an elite athlete, bring it down to a normal person, and let them try it. So this low back, arthritis, any kind of joint space, fantastic. So then I knew this is the waking moment, because this is how it's going to move into. This is the future. So because of that, that's why it's moving into the production where it's going to go into a, right now it's very, how would you say, it's for professional use only. So with that, it can only be, I sell to other doctors and they dispense it to the patient. Well, now if you understand about the signaling is what's important. Now I'm developing a plant-based with the same potency signals as this human tissue sourcing that gives you the more powerful information to tell your existing tissue to do things. But now the neat thing is that it goes directly to the consumer. Now I can go OTC right to the consumer so you can get it on the shelf. So that's what I'm excited about, this new transition that's occurring here.
Really cool.
I hope I didn't confuse you too much with all that.
Yeah, yeah. No, that's super cool. Um, what I'm curious, is there anything you've obviously, like you said, you've been in the space a long time. You have a deep history in generally these types of protocols from the injection into the topical. Is there anything that surprised you when in the science or like the development process, because you clearly it's something that you knew was effective, but I always feel like there's those surprise kind of, you turn the corner in the development process or as you're understanding the science of things like this, and it's just something you didn't expect. And I think, part of that's kind of, also the entrepreneurial journey. But yeah, anything come to mind from that perspective, again, from the science or just kind of as you were developing that was surprising, exciting, that when you peeled back the layer, you didn't expect?
I'll give you a discovery of my journey into this knowledge of what's going on. So as you go into it, there's a basic principle that we all know about stem cell therapy. It's supposed to make you feel better, heal faster. And then they talk about this mesenchymal stem cells that they say that differentiates or turns into your tissue, and voila, there it goes. But it doesn't really have any further detail. There's no mechanism. It doesn't make sense. So then you go to other providers that do stem cell therapy. Then you go further into it. Nobody really knows that mechanism. They don't really know how to explain how that live stem cell is going to turn into your cell. They'll say words like, pluripotent, potent, meaning that it has multiple choices of doing that transformation from the existing mesenchymal stem cell into your target tissue of tendons, ligaments, bone, muscle. It just knows what to do. Well, how to know? It just knows. It's a homing. There's got to be more than that. So that's what the discovery occurred to me, is that nobody really knows. I mean, that's why it was encouraging for me to kind of think like, all right, now if I go into it further, understand the messages. But the encouraging thing is that now the product is the explanation, the repetitive, Q&As and stuff like that. So what I had to do was write a book about this whole process of regenerative medicine in the future. Because now you're starting to hear words of like exosomes, right? You're hearing peptides. Well, that's signals. Those are information that we need in our body because we start slowing those kind of messages. And that's what this is all about. It's just signals that we are starting to deplete because of injury, trauma, or aging. If we get that signal as if we're younger, it would do great for our cells and regenerating tissue to do its job, its proper jobs. Because our tissue is there waiting for that information. We just don't have that right information because the signal is low and weak, they should say. So once I understood that, the discovery and teaching it, that's the difficulty right now. So my challenge right now is the educational component of it. Telling people this is what this is about. You hear all these buzzwords, right? You hear everything about exosomes now, and now it's like BPC 157, these peptides, right? Well, it's information, it's signals. That's what you're doing. You're just getting your body in these signals. They do it through an injectable. You're going to start hearing it through a topical pretty soon. And then now, once they understand about the topical application and how to get through the skin, now you're going to start seeing me probably mainstream pretty soon. So that's what the difficulty I found out starting this business is. I'm thinking I have no competition. I'm the first on the market. Patent pending. I'm doing fantastic. The education component is the curse. It's like, now I got to teach everybody this thing. So pretty much what happens is that, I start the process and the guy behind me is going to do well with it because I'm basically penetrating the educating, and the person that knows about like the marketing, the sales, they may prosper better than I do. But at least I'm talking about what the future of this whole regenerative and healing process is going to turn into.
Does that feel like that's been the hardest part? I mean, it strikes me. I imagine there was a shift in some way from you being a clinician to a biotech founder, and whether from a workflow perspective to expectations and what that actually looks and feels like on a day-to-day basis. Has that been one of the kind of maybe steepest learning curves or biggest lessons learned, or is there anything else that's been more challenging than maybe you thought, or thrown you a curveball?
Well, so it's interesting that there's two worlds, right? You've got the practical side of me, and then you've got the research side of me. The great thing about that is that I'm still in practice, so I can apply it right to my patients. I can just ask them directly. He goes, hey, would you like to try this out? Would you like to see this out? Because in this practice, this is real world. So I see what's out there. There's so many like products out there, and you see their machinery, devices, and supplements or topical, and you kind of have a feel for that. And then you talk to the actual person, the patient right here. And then you go into the voids, the holes, the missing or the shortcuts, and then you take it into that component of researching it. Why is this doing this? Why is there such delay of that? And you go into that kind of component of it. Then you kind of mix the two together. It goes, all right, let's see if this really does work. Let's see if I can have this patient try this out. So it's almost like a live type of like laboratory I get right away. Whereas if you're in the lab setting, you're just looking at the actual like the formulation, you're developing it, and then you have to take the next step, was look for a guy like me to actually like, all right, would you like to do a clinical trial? Would you like to be a participant and test it on your patients? So I get the best of both worlds here. I'm right real time doing everything on my patients.
Mm. Yeah, you have the perfect testing ground, and get that immediate feedback loop, more or less, which is the kind of entrepreneur's dream. I've been, you don't typically get that access, right? You have to go find a customer and then convince them to buy the thing and then ask them to give you feedback. And then maybe it doesn't work and you're back to the drawing board. And where here you can like apply it. There is that more kind of, maybe not necessarily immediate, but certainly a faster, access point to that feedback loop, where you then can tweak the product side and then deploy that on the business.
Yeah, I guess the best analysis is like, or analogy is like, if Ford were to have their R&D and then at the sales office, right, and then just start building something. Goes, hey kid, why don't you try this car out? And they'll give you a quick feedback. Save themselves years and years of research and like customers' feedback on something. You can get it right away.
Yeah, that's great. So we're talking, kind of primarily we've talked about more kind of high level athletes, and you're saying now with RheeGen, it's available currently only in kind of on the clinical side of things. But I'm curious, just from your perspective, as we think about just kind of the opportunities in front of us, as a general population, how does something like regenerative medicine apply to people who maybe don't see themselves as athletes, or maybe they're certainly not professional athletes? We're talking about, things come to mind are just general pain, aging, maybe stress from life, just trying to kind of balance all of the inputs that everyone has, regardless of if you're layering on something like high level, training and, professional athletes and the protocols that come with that. So from your perspective, how are you seeing, if we just forecast that out, maybe we look at it from currently what are the opportunities, and then maybe we forecast that into a bit more of a vision statement. What do you see as the opportunities for regenerative medicine for Gen Pop?
Well, here it is. So I'm in that age group that we want something. We are ready to get that type of that longevity in our life. So I'm at 50s. I'm at the late stage of 50 here. So I'm still active. I want to understand that there's got to be a life after I retire. I don't want to have this type of financial freedom and then going to retirement and then I can't walk for a mile. I can't do something. So you have to start preparing yourself by understanding the tools that are out there available to get that type of perfect tissue. So once you understand the anatomy and the process of what your body goes through as far as aging, and then if you can slow it down, reverse it, do something that kind of keeps those tissues, those cells to be healthy. So then when you start doing those activities, you're able to recover from that. So that's the mindset I have right now. So I don't know if it's a selfish reason why I'm here doing this, because it's really me. I'm talking to me about this. But I think right now, when you look at people my age, especially 40 plus, we're all thinking about staying active. Nobody wants to go on the European trip or go to Asia and not be able to do a hike and see the wonders of the world because I can't walk because I have arthritis in my knee or my back hurts too much. It's just simple understanding that you have tissue. Tissue breaks down. Tissue needs to recover. When you get older, the recovery lingers longer and longer. When you work out, for instance, let's say you do bench press and you do a workout with your chest, right? You're doing bench press and then you're supposed to give it a day of rest and go back at it when you're younger. Well, when you get older, you're looking at 2 days, 3 days rest, 4 days rest. Because when you break down that muscle tissue during your workout, you need that time to recover so it goes back to 100% because you want a bigger, better, stronger, right? The process is that we have that system that recovers quicker. The problem is that as we age, it slows down. So then when you start doing that same bench press workout and you don't give yourself 100% rest, now you're starting not at 100% muscle tissue, you're starting at 80%. Again, repeat that 60%, 40%. Now you're prone to muscle tear. Once you tear that muscle, here goes the restriction of that movement of that particular muscle action shoulder. So that's why you don't want to be at. You want to always want to be at 100% because, when you get to the point of that activity, you want to be recovering because you're going to do that walk, recover back, and then continue on. So that's the mindset that we all should have. Understanding about how to speed up recovery. So we're going to have to learn about these special tools, RheeGen, everything out there that can help you get back to normal.
Do you feel like just a focus on recovery and awareness about and around recovery is maybe one of the kind of key things that people can focus on when it comes to supporting longevity in general? I mean, again, aside from the tools like RheeGen and opportunities that people have to be more proactive from your perspective, is that something that keeps people from either quality of life or just being able to do the things they do, is just maybe a lack of awareness around recovery? Is there, and maybe the additional question to that is, is there anything, other practices that people can or should adopt that can aid in longevity? Because like you said, I think, everybody, it's a hotter button issue topic now than ever, but even naturally speaking, as we age, we start to think about, well, how can I get more of this, right? How can I get more quality of life? I want 40, 50 years. I want, you don't want to see that in. And so I think it's only natural too, is kind of, maybe just part of the human condition, right? We want to have more great years spending time doing things we like. So yeah, anything else, additionally, or is recovery kind of the so to say, like secret sauce that people are just kind of maybe not as focused on as they should be?
Well, recovery is very important. There's always like a team effort in just the actual application of what you're doing. Think about, like, you need the teammate that compresses you, that works you out, that pushes you, right? So you want that. Then you want the other teammate that helps you say, all right, let's go ahead and recover from this workout. How bad did we push? Did we push up to one max rep? Well, we probably broke down some muscle tissue because we want to get to that next level of strength. So we have to recover and listen to your body. You have to be very objective. You have to understand that old philosophy, or that saying, no pain, no gain. You've got to be really acutely understanding the outcome of that thought process. If you do it during a run, okay, that's your goal is to run 100 kilometers or whatever, 100 miles. I get that part. But then you have to understand that you have to recover from that. You can't say the next day I'm going to do another 100. You're going to destroy yourself with that. You have to understand and recover quicker. And that means you have to be educated. You have to know what's compressing. What are the joints that you're utilizing, pushing, and putting to the stress? How do you get back to normal? And those are the things that you have to ask. And goes, now I understand what joints. I understand what's the steps that have to get me back time frame wise. How can I now speed up? Where's my cheat code? What is my biohacking? What can I do? Then you look at these devices. Then you look at these topical creams. Then you look at these things. All right, I can get back quicker. That's what it is. It's just finding that little secret sauce, right? You're trying to get that going. And then once you're understanding it, keep going. And then you'll start seeing my progression will get better because I'm at 100% recovery. Now you see yourself performing better, doing better. Now, when you start going to that plateau and overtraining or overdoing yourself, you're going to start asking yourself, well, I used to be able to walk 1 mile in 15 minutes. Now I'm at 17 minutes, 18 minutes, but I do this every day. I'm 50 years old. Now the question is, okay, am I overtraining? Am I pushing? Where's my recovery? Why can't I recover quicker? Why can't I recover properly? Those are the questions you have to ask.
Yeah, that's great perspective. I think it's hard to see the forest for the trees when you're in it, So I think just having that kind of reflected back to us is no matter what age you're at, it's hard to see that. And it's certainly, I know from my own kind of athletic journey, I mean, I've been, involved at times at very high levels. But I've been an athlete my entire life, since I was 15 years old, and it's really hard. It's really easy to lose sight of how you've aged in that process. I mean, I'm in my 40s now. I can't. I remember what it felt like when I was 30, even, right? And but I'm not anymore, and so it's that just always being reminded of that you have to listen to your body, right? And you have to do what's best, and you can still, of course, set goals, but the path to those goals is going to look and feel differently, and that's something I think we all need to be reminded of, and again, just put back in front of us. So
Yeah, but the
that's
good,
great.
but the good thing about since you have been through the point of those little benchmarks called pain, and you understand that if I continue on, it gets worse. So it gives you that little educational component of a, hey, I learned my lesson with that first injury. Let's go ahead and prevent that from the second time going around. So
Yeah,
that's why I think it's very important for like us as we're going into that world of retirement and then pushing that age, is to understand about what's our level. If we push hard, understand the consequences, understand that component and how to recover from that.
yeah. Um, all right, all this talk about the future opportunities and regenerative medicine and what's coming up's got me thinking about the future and getting excited about what's on the horizon. And yeah, I'd love to know from your perspective, what's that next frontier of regenerative wellness, and maybe more specifically, why is it important? There's so many things that get thrown at us about longevity and health and wellness and what we should or shouldn't do, and all, and I think it's hard for general consumer to sort through that and understand what are the things that I can do that can really help and really serve my goals and help me live a longer life, or certainly a higher quality of life for longer. So yeah, what from your perspective, what's that next frontier look like, and why does it matter, and why are you excited about it for what's going to be available for us?
So the way I see where I'm moving and where I see where us as human beings are going to understand that we can be active at 100, 105. That's what the goal is. That's where I feel that understanding in the cellular level what is really going on, understanding about chromosomes and that little secret guy called telomeres, understanding why we need to extend that life. We have to think about that cellular component of it, and then making sure that those telomeres don't go in a thing called zombie state or senescence. Once you get that clue, which is really close, we've got a great. So Dr. Elizabeth Blackburn, she discovered an enzyme that increases telomeres. It's called telomerase. That enzyme increases telomeres. So the neat thing about that is that we are taking steps towards that. Here's a fun thing. You hear about a lot of people taking supplements and some type of like biohacking food or something like that. You have to remember there's gastric acids in our stomach that kind of denature these things. So it, in principle, yes, but in actuality, you've got to understand that sometimes the acid breaks it down too much that you don't get that perfect formulation in there. So that's why you hear about B12 injection. Everybody wants to do injectables because it bypasses the stomach. Well, that's where this topical world is coming into. So now you don't have to take a tablet. You can just rub a cream and you can get that type of whatever you want to get delivered faster through your system through a topical cream. So the world is going to change where you're going to start seeing it being a over the counter type of product you can just get and just rub it on your skin, and you can get that type of, if it is something that helps you with maybe your visceral organs, your cardiac tissue, or some type of like biological activation, you've got to get that signal in your body. That's what it's all about, is getting the signal in your body, and then understanding the mechanism of what goes through if you take a tablet through the mouth, or, how easy an injectable can do. But the problem is you have risk factors and it's tough to do it on your own too. So I'm really excited about the future moving to topical, and how we can really understand about this anti-aging, longevity, and really looking at the cellular level. And that's why I'm fantastically involved with all this stuff. So I'm excited about that.
That is exciting. Yeah, no, I think there's so much opportunity. I mean, it'll be really interesting to see even in the next 5 years, what comes to market, what is available, how our perceptions and access to these things shift. And I think, yeah, it's a really exciting time for health and wellness, and for, hopefully for people to really feel like they have the ability to be proactive in how they access, longevity, and take charge of their own wellness, and shifting from, a more kind of typically reactive approach to one that feels more proactive, and that's with, products like yours as well as others. There's it feels like individuals are now having more access that allows them more autonomy, right? And so with that, I think there's a lot of, people should be excited, right? It'd
Yeah.
be great to be able to feel like you can take charge of the quality of life that you have as you move into any stage of life. And I think anybody that's paying attention should be, excited about what's coming on the very near horizon.
Yeah, especially like look at the life we have right now. We've got Chat GPT, we got shows like this. I mean, the education component is so much more than we had in the past. Now we can actually go to the doctor and you start thinking about, hey, I've got elbow pain, and they may have a diagnosis, but then you say, well, I researched this. Could it be this? Challenge your doctor. If he takes offense from you questioning it, that might not be your doctor. If your doctor is like kind of like closed minded, goes, no, I can't be that. That's not who you want. You want someone like me. Like, we'll sit in the office and we'll say, all right, I want to educate patients. I want to educate athletes. Go, look, this is what you have. Let's look at your anatomy, know the structure, know what the purpose of this portion of your body, and then understand that this is an injury component of it. Once they get on the same page, once you're actually like understanding that he understands, it's so much easier to go through therapy. It's so much easier to talk to him about, hey, take this, do this. It's so much easier. So when you have a provider that doesn't do that, that doesn't say, for instance, like I have people always come in and go, hey, I just saw this podcast, or I saw this information. I go, great, let's talk about it. And they'll say, all right, great. And then we'll go into that component of that. And I'll say, all right, this is what that meant, and this is what you have. It's two different things, or it's the same thing. Let's continue on. But if you don't have a provider that does that doesn't really open-mindedly look at these kind of information, that's not the guy you want to talk to.
Yeah. I love that. Yeah. No, I think, it goes back to communication, right? Like we said, there's so much opportunity in just asking good questions and listening, and arriving at a solution that works for everyone. So, well, this is exciting, Dr. Rhee. I appreciate your time. It's certainly got me excited about what's to come. I'm excited for everything that you're doing in the space and all your contribution. And I can't thank you enough for your time. This has been a lot of fun. Thank you.
Man, thank you very much for this opportunity, man. Loved it.